Hello, everyone. Today we start the study of muscles. First, let's learn about the cervical muscles and shoulder muscles. The platysma is located in the superficial fascia of the neck. It is a cutaneous muscle. It is thin and broad. It originates from the fascia on the surface of the pectoralis major and deltoid muscles. It ascends and inserts into the angle of the mouth. It pulls the angle of the mouth downward and causes wrinkles on the neck skin. The sternocleidomastoid muscle is located under the skin on both sides of the neck. Most of it is covered by the platysma. It is a strong muscle and forms a prominent landmark in the neck. It originates from the anterior surface of the manubrium sterni and the sternal end of the clavicle. Its two heads converge, run obliquely backward and upward, and insert into the mastoid process of the temporal bone. Function on traction of one side of the muscle tilts the head to the same side and turns the face to the opposite side. Bilateral contraction can tilt the head backward. The main function of this muscle is to maintain the normal position of the head and make the posture correct. It also enables the head to move horizontally from one side to the other for observing things on both sides. When muscle contracture occurs due to lesions on one side, it can cause torticollis. The deep cervical muscles can be divided into medial and lateral groups. Lateral group located on both sides of the cervical segment of the spine. It includes the anterior scalene muscle, middle scalene muscle, and posterior scalene muscle. Each of these muscles originates from the transverse processes of the cervical vertebrae. Among them, the anterior and middle scalene muscles insert into the first rib, and the posterior scalene muscle inserts into the second rib. The space between the anterior and middle scalene muscles and the first rib is the scalene interval. The subclavian artery and brachial plexus pass through this interval. Hypertrophy or spasm of the anterior scalene muscle can compress these structures, causing corresponding symptoms, which is called anterior scalene syndrome. Function of the deep cervical muscle group. Contraction of one side of the muscle causes lateral flexion of the neck. Simultaneous contraction of both sides of the muscles can lift the first and second ribs to assist in deep breath. If the ribs are fixed, it can cause forward flexion of the neck. The medial group is located in front of the cervical segment of the spine, including the longus capitis and longus colli, collectively called the prevertebral muscles. Contraction of the prevertebral muscles can flex the head and neck. After learning about the cervical muscle groups, now we are going to study the superficial dorsal muscle group. The superficial dorsal muscles are divided into two layers, both originating from different parts of the spine and inserting into the pectoral girdle bones or free upper limb bones. The superficial layer includes the trapezius and latissimus dorsi. The deep surface of the superficial layer contains the levator scapulae and rhomboid muscle. The trapezius is located in the superficial layer of the nape and upper back. It is a triangular flat muscle, and the left and right sides together form a rhomboidal shape, hence its name. This muscle originates from the superior nuchal line, external occipital protuberance, nuchal ligament, spinous process of the seventh cervical vertebra, and spinous processes of all thoracic vertebrae. The upper muscle bundles run obliquely outward and downward, the middle ones run horizontally outward, and the lower ones run obliquely outward and upward. It inserts into the lateral one-third of the clavicle, acromion, and scapular spine. Function: draw the scapula closer to the spine. The upper muscle bundles can lift the scapula, and the lower muscle bundles can lower the scapula. If the scapula is fixed, contraction of one side of the muscle flexes the neck to the same side and turns the face to the opposite side. Simultaneous contraction of both sides can tilt the head backward. Paralysis of this muscle results in dropped shoulder. The latissimus dorsi is the largest flat muscle in the body, located in the lower half of the back and the posterolateral part of the chest. It originates via an aponeurosis from the spinous processes of the lower six thoracic vertebrae, spinous processes of all lumbar vertebrae, median sacral crest, and posterior part of the iliac crest. The muscle bundles converge outward and upward, pass along the medial side of the humerus to its anterior side, and insert via a flat tendon into the crest of the lesser tubercle of the humerus. Function: adduct, medially rotate, and extend the humerus. When the upper limb is raised and fixed, it can assist in pull-ups. Clinically, the latissimus dorsi is often used to make myocutaneous flaps or muscle flaps to repair large area defects or for cardiomyoplasty. In such cases, it will not have a serious impact on normal functions. The levator scapulae is located on both sides of the nape, deep to the trapezius. It originates from the transverse processes of the upper four cervical vertebrae and inserts into the superior angle of the scapula funcate. Lift the scapula and turn the inferior angle of the scapula inward. If the scapula is fixed, it can flex the neck to the same side. The rhomboid muscle is located deep to the trapezius and is a rhomboidal flat muscle. It originates from the spinous processes of the 6th, 7th cervical vertebrae and 1st, 4th thoracic vertebrae. Its fibers run downward and outward, inserting into the medial border of the scapula. Function: all the scapula inward and upward and draw it closer to the spine. Everyone, in this class, we have learned about the cervical muscles and dorsal muscles. We will learn about the pectoral muscles. Thank you.